If your doctor is more interested in delivering babies and doing hysterectomies, switch to one who is interested in hormones and can do what you need her to do. You do not go to a car mechanic to fix your lawnmower. So don't go to a gynecologist interested in delivering babies to deal with your menopause issues. Hello, welcome back to Gyno Info. Or if this is your first time, just welcome. I'm so glad you discovered us. In this podcast, we discuss common gynecological problems in a frank and open way that normal, everyday women can understand without a medical dictionary. Here's another question that a listener sent to questions@gynoinfo.net, where you too can send any questions related to women's healthcare that you might have. I will do my best to get to it in one of my question and answer segments, or use a whole episode to answer it, like for the question today. Keep looking for your answer. It will come. So here's the question I will answer today. I'm 43 years old and beginning to have some perimenopausal symptoms. My naturopath had me do some spit tests, saliva tests, and blood tests to measure my hormones before starting me on some natural remedies. She wants me to repeat these tests in 12 weeks to see if they change. Do you think this is a good idea? I am delighted to hear that you are paying attention to your body and facing what is happening with it head on. You're trying to find out what is going on and then do something about it. That is exactly what I encourage all women to do. You would do that with your stove or your car or any other tool or appliance you use. Why would you want to ignore your body when it's not functioning the way it has before or the way you need it to function? Surprisingly enough, a lot of women still ignore the signs their body is sending them. This is where Gyno Info comes in. You did not say what your symptoms are, but at 43, what is going on could well be perimenopause. You could be experiencing screwy periods, killer PMS symptoms, headaches, sleeping problems, brain fog, hot flashes, body aches, any number of symptoms I discussed in my podcast on perimenopause last August. I am less ecstatic, however, about your approach to helping yourself. And I'm afraid that it may turn out to be rather frustrating for you. Menopause and the year leading up to it, the perimenopause, are a completely natural process for all women. They happen when your ovaries first slow down and then eventually stop their egg production and the hormone production that goes along with it. It is the changing levels and lack of enough of the ovary hormone called estrogen that causes most of these crazy symptoms. But no naturopathic herbs will be able to stop nature. Some of the herbs might help you sleep, others might make your breasts less sore, or they might even push your ovaries to work a bit more regularly for another couple of months, possibly. You might even have fewer hot flashes for a while, either because of the herbs, but much more likely because your ovaries kicked back in and started working regularly for a while. And they often do that during the perimenopause. Only when the ovaries stop working altogether for a full 12 months in a row are you fully in the menopause. The years leading up to that are called perimenopause. But now, when your hot flashes disappear, you might think the herbs are working when it really is the ovaries deciding to work again for a while. And you will never know and will never be able to prove which one it is for sure. My bet is that it is your human ovaries that are causing your symptoms to disappear, not the herbs, because you're a human female, not a soybean or a yam or a red clover, common herbs used to supposedly treat hot flashes in women. Those natural remedies will definitely not keep you from losing bone or keep your vaginal tissues from drying out and shriveling up or stop your cholesterol from going higher and clogging the arteries in your heart or in your brain, which all happen after menopause without hormone treatment. That has been proven in several excellent scientific studies. The only thing that really helps all the effects of not having enough estrogen is natural human bioidentical estrogen, identical to what the human ovaries produce, not plant estrogens. As I said before, you are not a soybean or a yam or a red clover. You're a human female and need human hormones. Estrogen will need to be prescribed by a doctor or a nurse practitioner who is interested, informed, and up to date about perimenopause and menopause, and who will accompany you on this journey to the next phase of your life. Don't accept anything less. If your doctor is more interested in delivering babies and doing hysterectomies, switch to one who is interested in hormones and can do what you need her to do. You do not go to a car mechanic to fix your lawnmower. So don't go to a gynecologist interested in delivering babies to deal with your menopause issues. The hormone dose will need to be adjusted to how you feel, not what some lab value says, whether it is from a spit test or from a blood test. One size fits all will never work. It doesn't work for pantyhose and certainly does not work for hormone treatment for menopausal symptoms. The hormone treatment has to be adjusted for every woman individually, especially for herself. I can prescribe a hormone dose that I think will work for you, but only you can tell me if it is actually working for you. And on top of that, during the perimenopause, it will need to be adjusted again next week or next month. During the perimenopause, hormone levels go up and down from day to day, week to week, and month to month. They never stay exactly the same, so the exact same dose of a hormone treatment will not work. Sometimes the hormone levels are completely normal and you feel normal and your periods are normal too. When the hormone levels drop again, the symptoms start again. You have headaches, hot flashes, night sweats, can't sleep at night, and can't concentrate during the day. These are signs of low estrogen levels. Sometimes the estrogen levels go too high. That is when your breasts begin to ache and get all lumpy. And if you're still having periods, your bleeding will get too heavy. That is why you will need to be working closely with your medical provider so we can adjust your treatments to how you feel. Lab tests will not be of any help for that. This is another thing that bothers me about what your nature path is suggesting. Blood levels of hormones produced by the ovaries are pretty much useless in both the diagnosis and the management of menopause and perimenopause symptoms, according to all medical experts on menopause and menopause guidelines anywhere in the world. That is because they change so much, as I said, from day to day during this phase in your life. You might, however, want to check thyroid hormone levels to make sure that it is not the thyroid problem that is causing the periods to be irregular, causing the hair loss, the weight gain, and the tiredness. All symptoms that can happen because your thyroid gland is not working properly and not producing enough thyroid hormones. It is also a good idea to measure a prolactin hormone level. Prolactin is made by the pituitary gland, a gland that sits at the bottom of the brain. It regulates milk production when you're nursing, but it can also be too high and disturb or stop your periods because of a tumor in that pituitary gland. These tumors are almost always not cancer, and they can be managed with medications, and they rarely need surgery. But if you do not find out that you have such a tumor because you do not check for it, the tumor can press on the nerves that serve your eyes and cause major problems with your vision. Measuring the hormones produced by the ovaries is a complete waste of money. What your medical provider should do is talk to you, listen to you, and see how you feel. Everything else is BS or rubbish, garbage in American, as my British daughter-in-law would say more politely. It's my new favorite word. Even more of a waste of money is measuring the spit or saliva hormone levels. You spit 10 times and you get 10 different results, which is of course completely useless. That is why measuring anything in your spit is a total ripoff. There is a whole big money-making industry behind it because spit hormone levels can be measured by self-declared medical practitioners without a medical license. Not knowing any better, women are being exploited and talked into getting spit tests and have to pay a lot of money for useless tests that do not help them. even if they do happen to have health insurance, they will have to pay for those spit tests themselves because insurance companies do not pay for them. Saliva or spit tests are not accepted as valid and reliable tests by any serious medical experts and any major medical guidelines around the world, which is, of course, the reason why medical insurances refuse to pay for them. To be able to draw blood and measure blood levels, you need a medical license, which you can only get with the right education and training to know what you're doing. So this was a bit a long answer for your question, but something I'm very passionate about. I think many women get ripped off by self-declared menopause experts and are wasting a lot of money on unhelpful tests and unhelpful treatments. Often, they're giving herbal treatments that have been proven to be less effective than a sugar pill, a placebo, and may even be harmful. And they leave them frustrated and discouraged. When real help in the form of natural human bioidentical hormones would be available, and they would even be paid by the health insurance if they're lucky enough to have one. But please do not misunderstand me. I'm not against all herbal treatments. I prescribe some of them myself. They can be very helpful for many things. They are just not effective treatments for perimenopause and menopause symptoms. There, you need natural human hormones, not plant stuff, no matter how natural. Which brings me to another thing that gets me all worked up, the word natural. All this word really means is that something occurs in nature. It is neither a guarantee that it will work for what you need it to work for, nor is it a guarantee that it is safe. The most poisonous thing on this planet are natural, such as snake venom and poisonous mushrooms and poisonous berries and other plants. And at worst, the word natural is a marketing word used to get you to buy things that may not work. So going back to our listener's question, my recommendation is that you find a medical provider that not only knows what she's doing about hormones and carefully listens to her, but also is licensed to test what makes sense to test and to prescribe medications for her that actually work. This brings me to the end of this episode. I hope you liked it and it gave you a lot of information that is useful to you or your friends or coworkers. And if you have any further questions on this or any other topic having to do with women's health, please don't hesitate to send them to me at questions@gynoinfo.net. Again, that's questions@gynoinfo.net. And if you like this episode, please give us a lot of likes and share it around. It will also be super nice if you could subscribe to Gyno Info. It helps Josh and me to keep this podcast going. And now I think we have just time for another one of my life tips for the week. This is today's life tip. If you want to discuss something serious with your man, take him for a walk. Women like to chat about things over a cup of tea or a drink. Men freak out at the very thought. The words, "let's sit down and talk about this," can send even the best of men into a real panic and complete shutdown. But when you walk along next to them in the park or just around the block, they can usually listen to you, hear you, and respond rationally. You just have to keep it fairly low key. Try it. It really works. Thank you for listening. Until next time, thank you for listening. And remember that you and your health are super important and deserve your full attention. Don't ever put off contacting your doctor because you're scared or embarrassed when something feels wrong about your body. Doctors are here to help you and not to judge you. And also, regular well-woman visits are always a good idea that you should make time for. You deserve it, and you owe it to yourself, and you owe it to your body and your health. This podcast is part of Pride House Media, hosted by me, Dr. Burki, produced and edited by Josh Rosenzweig. Original music composed by Nell Balaban. If you enjoyed this episode, please subscribe wherever you listen to podcasts. And while you're there, leave us a rating and a review. It really helps others discover the show. Stay connected and join the conversation by following me on Instagram and Facebook at GynoInfo and on LinkedIn at GynoInfo Podcast.
Remember, any questions that I answer or information that I give you on this podcast are to be understood as information only, not treatment of your medical problems. While I'm a very knowledgeable gynecologist, I'm not your gynecologist who has talked to you and examined you personally and is therefore actually able to treat you. So please consult your own healthcare professional with any medical questions or concerns.